Every man experiences a moment of profound, simple release. But what happens in the 5 minutes after masturbation is often a silent, health-damaging ritual. Are you unknowingly compromising your prostate health, wrecking your sleep quality, or inviting chronic inflammation? Most men treat the post-ejaculatory phase as an afterthought, missing crucial physiological and psychological shifts. I'm here to expose the 5 critical mistakes you must stop immediately. This isn't just about hygiene. It's about mastering a hidden health protocol that safeguards your vitality, energy, and long-term well-being. This knowledge will redefine your recovery and self-care. The 5 post-climax mistakes. Sabotaging your health. I'm Dr. Vera Sterling, a specialist in urology and male health, and today, we are addressing a profoundly important but rarely discussed aspect of men's health, the post-climax protocol. While much focus is given to the act itself, the moments immediately following, masturbation trigger deep physiological and psychological shifts that can either boost your well-being or silently sabotage your health. My clinical experience has revealed 5 common, critical mistakes men, especially those over 40, make in the minutes after ejaculation. These aren't minor oversights. They are habits that impact everything from your nervous system balance to your long-term urological health. The first mistake is arguably the most common and involves the central nervous system. Mistake number 1, immediately engaging in high-intensity, stimulating activity. After climax, the body is flooded with several powerful neurochemicals. Prolactin, often called the sleep hormone, spikes, initiating the refractory period. Simultaneously, the parasympathetic nervous system, the system responsible for rest and digest, takes over to calm the body. This is a crucial window for your body to achieve deep equilibrium. The mistake many men make is immediately diving into an activity that re-engages the sympathetic nervous system, the fight-or-flight mode. This could be checking a stressful work email, scrolling through fast-paced social media feeds, or jumping straight into an intense problem-solving task. By forcing your brain to switch instantly from deep relaxation, parasympathetic, back to high alert, sympathetic, you create a state of neurological dissonance. This rapid flip-flop interferes with the brain's natural opioid and cannabinoid reward systems, delaying the peaceful, contented feeling that should follow release. Over time, this habit can dull your body's sensitivity to natural stress-reducing hormones, making you more prone to anxiety and chronic overstimulation, thereby hindering your recovery and making subsequent relaxation more difficult. The healthy response is to allow a brief period of conscious decompression, even just 2 minutes of stillness. The second mistake directly impacts the urogenital system. Mistake number 2, neglecting immediate and thorough post-ejaculatory hygiene. While this may seem obvious, the timing and completeness of the cleanup are critical, especially as men age. The urethra and the surface of the penis, particularly under the foreskin if uncircumcised, can retain small traces of semen and, more importantly, residual moisture. Semen, being a protein-rich fluid, can act as a breeding ground for bacteria if left to dry on the skin. For men over 40, issues like prostatitis, prostate inflammation, and minor urinary tract infections, UTIs, become more common due to reduced immunity and potential urinary retention issues. Poor or delayed hygiene provides a pathway for opportunistic bacteria to migrate toward the urethral opening and potentially the bladder. The key is to gently wash the area with warm water immediately, focusing on the urethral opening, and then pat the area completely dry. Ignoring this step, perhaps just using a quick, incomplete wipe, is an open invitation to minor irritation and potential infection, contributing to the cycle of pelvic floor discomfort that many older men experience. The third mistake is a subtle energy drain that impacts recovery. Mistake number 3, immediately drinking ice-cold or highly sugary beverages. The sudden temperature shock of an ice-cold drink, especially if consumed rapidly, forces the body to divert energy to re-regulating core temperature. After orgasm, the body's internal systems, including blood pressure and circulation, are recalibrating. Introducing a shock factor interrupts this smooth transition. Furthermore, the consumption of highly sugary drinks, sodas, energy drinks, or sweet juices spikes blood sugar levels. The post-orgasmic body is already dealing with a mild stress response related to muscle exertion and hormonal shifts. Introducing a massive blood sugar spike creates a secondary unnecessary stressor. The body must expend precious energy rapidly processing this sugar, leading to a quick insulin crash, which results in the classic feeling of fatigue, sluggishness, and the unpleasant crash often mistaken for normal post-coital sleepiness. A far healthier approach is to rehydrate with room temperature water to aid natural circulation without shock. The fourth mistake is a physical habit that compromises core musculature. Mistake number 4, instantly clenching the pelvic floor muscles, Kegels, or holding urine. Many men have been taught to perform Kegel exercises for control or endurance. While beneficial when done correctly at appropriate times, attempting to perform a powerful, sustained pelvic floor clench immediately, post-ejaculation, is counterproductive. During orgasm, the pelvic floor muscles undergo intense, involuntary, rhythmic contractions. They are, quite literally, exhausted. Forcing them into an immediate, voluntary, high-tension contraction prevents them from entering their necessary recovery phase. This can contribute to hypertonic pelvic floor syndrome, a condition where the muscles remain overly tight and contracted, leading to chronic pelvic pain, difficulty fully emptying the bladder, and even premature ejaculation in the long term. Instead of clenching, the body needs softness and release. The ideal is to allow the muscles to passively relax and breathe through the area to encourage proper circulation and recovery. The fifth mistake is a common sleep strategy that often backfires. Mistake number 5, immediately falling asleep, without conscious bladder relief. The natural relaxation that follows climax often leads to instant drowsiness. However, many men neglect to empty their bladder immediately before lying down to sleep. During the act, the body suppresses the urge to urinate. After the climax, with the bladder likely full, especially if the man had ignored the urge beforehand, and the muscles of the pelvic floor momentarily relaxed, the bladder may not have been completely voided. If a man falls instantly asleep with a partially full bladder, the concentrated lingering urine increases the risk of bladder wall irritation and provides bacteria with a warm, moist environment to multiply overnight, linking back to the previous point about UTIs and prostatitis. More importantly, the weight and pressure of the full bladder can interfere with the depth and quality of sleep, often leading to a sudden, urgent awakening later in the night. The protocol here is simple, yet crucial. Take a moment to fully empty your bladder before settling in for deep, restorative rest. These 5 mistakes, practiced consistently over years, create a compounding negative effect on the male body, physiologically, urologically, and psychologically. They disrupt the nervous system, invite bacteria, interfere with muscle recovery, and degrade sleep quality. Now that we have identified the 5 sabotaging habits, we must turn our attention to the 5 pillars of the ideal post-climax protocol. This will detail the specific actions, the deliberate replacements for these mistakes, that will transform your post-ejaculatory phase from a health risk into a powerful ritual for recovery and well-being. We will explore the specific neurological benefits of guided breathing and the anatomical necessity of certain movements. Part 2. The 5 pillars of the ideal post-climax protocol. Continue my guidance on the post-climax protocol. Having identified the 5 critical mistakes, we now establish the 5 pillars, the deliberate, health-affirming actions that replace those negative habits and ensure optimal recovery, vitality, and health. This is about harnessing the powerful, natural neurochemical release of orgasm and channeling it into genuine well-being. Pillar number 1, the 2-minute neurological anchor, replacing high-intensity activity. Instead of jolting your nervous system back to stress, immediately commit to a 2-minute neurological anchor. This is a deliberate period of stillness and passive observation. It means putting down the phone, silencing the TV, and simply lying still. The anchor should include controlled, diaphragmatic breathing. Breathe in slowly and deeply, allowing your belly to rise, and exhale slowly, focusing on the complete relaxation of your jaw and shoulders. This specific breathing technique reinforces the dominance of the parasympathetic nervous system, allowing the beneficial surge of oxytocin and prolactin to take full effect. It allows the brain's emotional centers to fully process the pleasurable experience, reinforcing the psychological bond of the act and solidifying feelings of calm contentment. This simple anchor maximizes the natural mood-boosting effects of climax and prevents the feeling of being rushed or unsettled, ensuring that the act serves as a genuine, deep emotional reset. Pillar number 2, the triple action urogenital reset, replacing negligent hygiene. This pillar involves 3 precise actions to safeguard your urinary tract. First, immediate gentle cleansing. As discussed, use warm water and mild, non-scented soap to clean the urethral opening and surrounding tissue. Second, full bladder voiding. Make a conscious effort to empty the bladder completely. This flushes out any bacteria that may have been pressed up the urethra during the act. Third, complete drying. Pat the entire area dry with a clean, dedicated towel. Leaving any moisture creates a perfect environment for fungal or bacterial growth, leading to common irritations that can escalate into deeper urological issues like chronic epididymitis or balanitis, conditions men over 50 are disproportionately susceptible to. This triple action approach is a proactive barrier against infection and inflammation. Pillar number 3, mindful rehydration and temperature balance, replacing cold, sugary shocks. After physical exertion, especially one involving deep muscle contraction and hormonal shift, your body has lost fluids and needs gentle replenishment. The ideal post-climax drink is room temperature filtered water with a pinch of sea salt for electrolyte balance. Why room temperature? It avoids thermal shock to the digestive and circulatory systems, allowing for efficient absorption. The salt provides trace minerals lost through exertion and sweat. Avoid high-sugar drinks entirely. Instead, if you crave a metabolic boost, opt for a small piece of dark chocolate, 70% cocoa or higher. Dark chocolate is rich in tryptophan, which supports serotonin production, and is a source of magnesium, which is crucial for muscle and nerve recovery. This mindful rehydration process supports systemic recovery, without creating a disruptive blood sugar spike or taxing the body's digestive energy. Pillar 4. The passive pelvic floor release, replacing immediate clenching. Instead of damaging your pelvic floor with immediate, intense Kegels, the goal is passive release. As you lie during the neurological anchor, perform a gentle passive stretch. One highly effective technique is the supine butterfly pose, Supta Baddha Konasana. Lie on your back, bring the soles of your feet together, and let your knees fall open gently. Place your hands lightly on your lower abdomen. This position creates a soft, external stretch on the inner thighs and pelvic floor, encouraging blood flow back to the area and passively releasing the muscles from their orgasmic tension. Hold this gentle stretch for 60 to 90 seconds. This simple act counteracts the hypertonicity that often leads to chronic pelvic pain in aging men, promoting better circulation to the perineum and reducing the likelihood of nerve compression issues over time. It is a critical component of preventing future pelvic dysfunction. Pillar number 5, the post-intimacy transition, replacing instant sleep. This pillar is both physical and psychological. You must create a transition window before deep sleep. This is the integration of pillars number 2 and number 4, the complete bladder voiding and the pelvic floor release, followed by a few minutes of conscious connection, even during self-intimacy. If you are with a partner, the transition involves light, non-demanding touch, a hand on the shoulder, gentle spooning. This reinforces the psychological safety established by the parasympathetic activation. If you are alone, the transition is a moment of gratitude and self-care, mentally noting the feeling of calm and release. This final pillar ensures that the positive, stress-reducing, and pleasure-reinforcing memories are solidified in your brain, enhancing your overall mental health. By ensuring the bladder is completely empty and the body is passively relaxed, you safeguard against the 2 primary causes of poor post-intimacy sleep: pelvic tension and the urgent need to urinate. By committing to these 5 pillars, You transform a potentially damaging habit into a powerful ritual of self-care. The post-climax phase is not a void. It is a vital bridge to recovery and well-being. Mastery of this protocol is the key to maintaining not just your sexual health, but your energy, sleep quality, and lifelong vitality.